Jennylyn Gleave, your host. On this segment of my show, various physicians will be debunking myths associated with their specialties and sharing what is new and cutting edge in the field of medicine. Today, Dr. Cesar Molina, who specializes in cardiovascular disease and interventional cardiology, will be debunking medical myths associated with cardiology. Don't be surprised if some of what you believed over the years turn out to be myths. Dr. Molina explains good and bad cholesterol and lots more. Find out if dying of a broken heart is a myth. Stay tuned. Dr. Molina is incredibly informative. He is a reputable cardiologist, and since so many people are dying of heart disease lately, make sure that you know the facts and are not a believer of the myths. Here is Dr. Molina.
So the question is, what is the role of alcohol, wine in particular, health and longevity? And a lot has been written about the health benefits of wine. But the active ingredient of wine, just like the active ingredient of many other alcoholic beverages, is alcohol. And alcohol consumption is associated with a reduction in cardiovascular disease. The question is then, what is a sweet spot? And alcohol has an interesting U-shaped curve as it refers to longevity. And that is, the longevity increases as the individual goes from drinking no alcohol to 1 to 2 drinks of alcohol per day. And then once the alcohol consumption goes to 3 drinks per day, that benefit from the alcohol on longevity tends to disappear, and you have increased risk of cardiovascular complications. The consumption of alcohol is associated with a 30% reduction in cardiovascular disease and heart attack in particular, but you have to be careful because alcohol consumption, particularly in women, is associated with an increased risk of breast cancer, and it can increase the risk of breast cancer by 8%. The question is, what lifestyle factors have been associated with successful aging and longevity? Successful aging is defined as the ability to remain self-sufficient and autonomous, to take care of yourself, live in your own home, take care of your own shopping and all your regular needs. There was a study that was done in Alameda County, and they followed 7,000 citizens over a 25-year period, and they identified 7 factors associated with successful aging and longevity. Those 7 factors were ideal weight, not smoking, having breakfast daily, having regular meals and not snacking, having no more than 5 alcoholic beverages per day, burning about 210 calories in physical activity per day, and sleeping between 7 to 8 hours per night. Yeah, this is actually a question that is commonly asked, and that is, what do we mean by having regular meals, and what do we mean by snacking? The problem is that snacking is associated with a consumption of poor nutritional value foods like chips, candies, crackers, and what we consider to be junk food. The fact is that it is best to have 3 to 4 regular meals per day. Having fewer than that is associated with a 450% increased risk of obesity, particularly if you skip breakfast. So all the data, in fact, all the scientific data suggest that there is a benefit to sitting down and having a regular meal than to be eating all day long like a cow. Well, a heart attack means a lot of things to different people. But in medicine, what we mean by a heart attack, or another word for a heart attack, is a myocardial infarction. And what that means is that there is death of the part of the heart muscle due to lack of blood flow. The heart is a muscle. And here we have an exaggerated, that is an oversized heart. And we can see here in the red the arteries, and in the blue the veins. The arteries take the blood, the nutrients and the oxygen to the heart muscle, and the veins bring the carbon dioxide and the spoils of digestion back into the circulation for disposal. When we are talking about a heart attack, what we mean is that there has been an abrupt closure of an artery, therefore preventing blood flow and oxygen delivery to the heart muscle, and then leading to the eventual death of that heart muscle secondary to asphyxiation of that heart muscle. Well, it means that the heart muscle dies. Now, if the person does not tolerate the heart attack well, or if the heart attack is very large, it can actually lead to death. 60% of people with a heart attack never make it to the hospital because they die at the moment of the heart attack. Once they arrive to the hospital, the mortality rate is about 12%. Actually, aspirin consumption at the moment of a heart attack is associated with a reduction in the amount of damage to the heart muscle and an enhancement in survival from the heart attack. You know, we're always looking for the Hollywood heart attack, where we have a man in the cold coming out of a restaurant holding onto his chest as he is having a heart attack. Well, that is not the typical presentation for a woman who's having a heart attack, even though many of them will have the same symptoms with unexplained chest discomfort. This chest discomfort can be severe pain or minor pain. Many times women will have other symptoms like shortness of breath or very severe fatigue or unexplained dizziness or neck discomfort. So women at times can present with varying symptoms which are not commonly expected as we expect the typical Hollywood heart attack. Well, the question is, when do we start paying attention to our cardiovascular system? And the answer is at the moment of our birth. And that is, we have a continuity of existence. And we learn how to eat, we learn how to live as a child. And it is at that time in our lives where we acquire the habits that are going to either lead to successful aging or premature illness, disease, disability, and death. So we have to pay attention to our health from the beginning, particularly when it is obvious and known to all and is half done. We know that arteriosclerosis can start at a young age, and in autopsies of children who have had unexpected death, we have seen arteriosclerosis involving the aorta at a young age. So this condition can start at any time. The question is, what is the role of genetics or family history in heart disease and other chronic conditions that affect us, such as diabetes, hypertension, stroke, and heart disease, cancer? Genetics are important, but these conditions that I just mentioned, particularly heart disease, is a polygenic, that is many genes, behavior or environmental interaction. It is not just one gene. And family history, in fact, has not been identified as an independent risk factor in the occurrence of premature heart disease or heart attack. The InterHeart trial, which was a study looking at 15,000 people with heart attacks across the world, identified 9 independent risk factors, and family history was not an independent risk factor. Family history, however, is important, but it does not explain most of the heart disease. And for it to be of any significance, the heart disease in the parent, particularly in the father, has to occur before the age of 55, and in the mother before the age of 65. The question is hypertension or high blood pressure or high cholesterol or high blood sugar symptomatic? That is, do you experience it when the blood sugar is elevated, or when the blood pressure is elevated, or the cholesterol is elevated? Those conditions tend to have no symptoms. They're silent killers. You can have a blood pressure of 200 over 120 and feel perfectly fine. So you have to be careful because some individuals will state that they know when their blood pressure is high because they don't feel well. But what's really happening is that they feel unwell, and that feeling of unwellness is associated with an elevation, that is, it causes their blood pressure to go up rather than the other way around. High blood pressure and high cholesterol are asymptomatic, that is, without symptom conditions. They can lead to serious problems that are associated with symptoms, such as a heart attack or stroke or renal failure or congestive heart failure. So the question is, what is the role of stress in cardiovascular health? And there are actually two answers to that. We know that stress can account for 32% of heart attacks. That is, the population accountable ratio of stress is about 32.9. That is, if you remove stress, you would decrease heart attacks by about 33%. So that's with the issue of a heart attack. But how about this broken heart syndrome that is much more common in Japan, but is now being seen in this country? It's also known as Takotsubo cardiomyopathy or adrenergic cardiomyopathy. And what happens is that after a significant episode associated with stress, the individual will get chest discomfort just like having a heart attack, will present to the emergency room just like having a heart attack, and there is significant heart damage. And the heart appears like there has been a heart attack without an obstruction of a coronary artery. Most of these individuals will recover, but it's sort of indicative on the deadly effect of stress on our physiology and particularly our heart. Well, the question is, do you always have to see chest pain in the setting of a heart attack? 20% of individuals will have what we call a silent heart attack or myocardial infarction. That is, they will not experience chest discomfort or chest pain. They may experience something like indigestion or no symptom at all, and they may be having a myocardial infarction. This is more common in diabetics than in other populations, but it can happen to in any kind of situation or any individual. And if you don't know that it's happening, then therefore it's very difficult to seek medical attention. But there are a subset of individuals who are at increased risk, and therefore they need to be carefully followed, particularly the diabetics. The presence of diabetes in an individual increases the risk of a heart attack in that individual, like if he had or she had already had a prior heart attack. The question is, what is the role of fitness in our overall longevity and in cardiovascular disease? Well, fitness is the most important predictor of longevity. Fitness is more important than other diagnoses such as high blood pressure, emphysema, chronic bronchitis, or even diabetes. However, the fact that you're fit or strong is not a sure bet that you will not have a heart attack. And we have always read about these great athletes who actually have had heart attacks while running or jogging. So heart disease can affect everybody, fit and unfit. But obviously those who are fit have a lower risk of heart attacks and a higher chance of surviving if they have a heart attack. Well, in our nation, in our country, vegetarians tend to have a lower incidence of heart disease than non-vegetarians. However, the vegetarian lifestyle does not preclude the possibility of heart disease. And in fact, South Asians, individuals from the Indian subcontinent who are mainly vegetarian, tend to have the highest incidence of heart disease in the world. Now, the type of vegetarian diet is different than other types of vegetarian diet. That is, they tend to have more of a grain-based vegetarian diet than a green or vegetable-based vegetarian diet. The question is, what is the role of nitroglycerin in cardiovascular disease? Nitroglycerin is an old medication, a very effective medication, and it is used to relieve the symptoms of angina and shortness of breath brought on by heart disease or a narrowing of a coronary artery. Now, will taking a nitroglycerin save your life? Well, if you have coronary artery spasm, the nitroglycerin will relieve the spasm and will decrease your risk of having a life-threatening arrhythmia. But we don't think of nitroglycerin as a life-saving drug. We see it as a drug that helps us treat coronary artery disease and in many ways relieve the symptoms of coronary artery disease. For the most part, we don't consider it as a drug that affects the course of the disease. The course of the disease, the final outcome of the disease, is more dependent on your lifestyle and the control of blood pressure, the cessation of tobacco use, and the appropriate adjustment for high cholesterol levels. The role of salt in cardiovascular disease is an interesting question because the intake of salt itself is not associated with an increased risk of coronary artery disease. It does not clog up your arteries. However, increased salt intake in a society tends to be associated with higher blood pressure, and that higher blood pressure tends to be associated with an increased risk of stroke and cardiovascular and or coronary artery disease. But the short answer is that salt by itself does not clog the arteries. Well, what happens is this: salt equals volume. So you have increased salt intake that is followed by increased water intake. Therefore, you have increased volume, and the heart has to pump more of this volume to the kidney to get rid of it and dispose of it. If you have increased volume, then you can also have increased flow, and that increased flow can then be associated with increased pressure. Well, this myth that women are at higher risk of dying from breast cancer than heart disease is prevalent in our society. It is amazing how many women rush every year to have their mammogram, when in fact heart disease kills over 50% of women, and therefore is the most common cause of death in our society. Heart disease and stroke are more common causes of death in women than breast cancer. In fact, more women today than men are dying of heart disease. Heart disease is no longer a disease of men. Heart disease now is actually a disease of both genders, and unfortunately more women die of heart disease today than men. What should prompt a woman to seek cardiovascular evaluation? Well, every citizen, man or woman, if they're having chest discomfort, it doesn't have to be pain. It can just be a vague discomfort, some ache, some pressure, some minor feeling or sensation in the chest, unexplained shortness of breath, palpitations or irregular beating of the heart, unusual and unexplained fatigue. That should prompt the individual to seek medical attention. Particularly, a woman tends to sort of have this kind of philosophy, well, let me see if it just goes away by itself. And the reason is that because women's chest is different than men, they tend to have a lot more false warnings. But anyhow, they should always, if they're having symptoms of that sort, they should look for their physician, and then seek medical attention and complete evaluation. Maybe it is actually, the question is, do you need to take antibiotics before dental procedures if you have a heart murmur? And in the past, it was recommended that you take antibiotics prior to dental procedures to prevent subacute bacterial endocarditis. Those recommendations have changed, and for the most part, and in most individuals, the need for antibiotic prophylaxis is no longer there, even if they have a heart murmur. There are special circumstances where antibiotic prophylaxis is recommended, such as in individuals who have a prior episodes of subacute bacterial endocarditis, or if they have significant congenital heart disease or valvular disease. So there are many factors. So the question is, what is the role of diabetes in cardiovascular disease? Diabetes is a very significant and important risk factor for heart attack and cardiovascular disease and stroke. Unfortunately, the complete control of the blood sugar is in the presence of the diagnosis of diabetes does not guarantee and or completely eliminate the risk of heart disease in diabetes. Therefore, the most important maneuver is to prevent the onset or development of diabetes. And we know that we can prevent the onset or development of diabetes in 58% of individuals within 2.8 years if they go into an exercise and good nutrition program. For many years, hormones were being prescribed in postmenopausal women for the prevention of heart disease. That is no longer the case because various scientific studies have shown that that is not the case. So hormone replacement therapy are not indicated in the postmenopausal woman for the prevention of heart disease. In fact, they increase the risk and incidence of vascular events. However, if you are disabled by your postmenopausal symptoms or menopausal symptoms, with disabling hot flashes, insomnia, mood changes, in that situation, a brief course of hormone replacement therapy may be indicated, making sure that you have periods where you discontinue the medication to see if those symptoms are still present. Cholesterol, what is the role of cholesterol as a risk factor for cardiovascular disease? Total cholesterol is not a very powerful risk factor for coronary artery disease unless you have a familial hypercholesterolemia where you have very, very, very high levels of cholesterol in the 500, 600 range. But what we know is that about 80% of people who show up in the emergency room with a heart attack will have normal cholesterols that are similar to those individuals who are not having a heart attack. So cholesterol itself is not a very powerful risk factor for heart disease at the levels that we mainly see in individuals having a heart attack. However, the treatment of high cholesterol is a very powerful tool to decrease the risk of recurrent heart attacks and or new heart attacks. In the primary prevention of heart disease, the treatment of high cholesterol with statins can decrease the incidence of heart attack by 1/3. So this is really important. Just because you're taking a statin or a medication to lower the cholesterol does not guarantee you that you will not have a heart attack. It will only decrease your risk by 1/3. These drugs, which are very good, very important in the treatment of heart disease and in the prevention of heart disease, have also been shown not to enhance longevity, but they decrease the risk of stroke and heart attack by about 1/3. You still have a residual risk of about 60 to 70%. So you need to pay attention to other risk factors such as high blood pressure, sedentary lifestyle, smoking, excessive intake of sugary drinks, excessive intake of junk food, and stress. The question is, what is cholesterol and how is it that we measure cholesterol? Well, cholesterol by itself does not exist circulating in our bloodstream. Cholesterol exists in particles. Now, what is the role of this cholesterol? Well, this cholesterol is formed by the liver and is delivered in these particles to the tissues because most of our cell membranes are mainly made of cholesterol. We are mainly made of cholesterol. So these particles move the cholesterol from the liver to the tissues so that the tissues can regenerate themselves and regenerate their cell membranes with new cholesterol. Though that cholesterol moves in these particles. Some of these particles, 7 of them, are grouped in LDL cholesterol, and those LDL cholesterol is thought to be the so-called bad cholesterol. 5 other particles move cholesterol back to the liver, and those are actually called the HDL cholesterol, and that HDL cholesterol, highly desirable cholesterol, is the good cholesterol. The game plan is to have higher levels of good cholesterol and lower levels of the bad cholesterol. The question is, once you're diagnosed with coronary artery disease, is there anything that you can do to improve your outcome, your survival? Can you reverse coronary artery disease. When I was going to medical school in the 1970s, the diagnosis of angina or coronary artery disease was analogous to a prescription or a kiss of death. There was not much that we could do. Now things have changed. Now we know that we can reverse coronary artery disease, that we can decrease the size of the narrowing, but more importantly, we can stabilize the artery so that there are no new blockages and that there are no new heart attacks within those blockages. So how do we do that? Well, there is a role for pharmaceuticals such as statins and aspirin, but there is even a bigger role for lifestyle, eating well, 2 fists or 2 cups of vegetables, cooked vegetables every day, a fist or a fist and a half of fresh fruit per day, eating oily fish twice weekly, and having nuts daily, about 12 of them daily. That's the part of the nutrition, sort of mimicking the Mediterranean diet. Exercise, being physically active, and being physically active every day, at least 5 to 6 days of the week, and burning about at least 210 calories per day in physical activity, going on a brisk walk at between 30 and 60 minutes per day. And sleeping. There is a sweet spot to sleeping. The sweet spot is 7 to 8 hours. Those who sleep 6 or fewer hours tend to have a higher incidence of hypertension and heart attack and heart disease. Those who sleep 9 or more hours tend to have a higher risk for diabetes and cancer and increased mortality from other causes. So, in summary, consumption of vegetables, fruit, oily fish, nuts. 7 to 8 hours of sleep per night. Being physically active, not smoking, and trying to maintain your ideal weight that is not being obese, as well as taking medications such as statins, aspirin, and other agents.